Over on my Instagram, by the way, if you're not already following me over there, make sure you do so. But a couple weeks back over on my Instagram, when I had the twin-to-twin transfusion surgery, I posted like a little Q&A and asked people for their questions about the surgery and the process. So we're going to do a little twin-to-twin transfusion syndrome Q&A. And if you don't know what that is, or if you aren't familiar with my story, don't forget to check it out up here. I've talked about it a few times on my channel now. It's been a big part of my pregnancy journey with twins, so it is something that's in the forefront of my mind pretty much every day. So I thought this would be a good time to shed some light and talk about it and answer some questions. So we had our twin-to-twin transfusion syndrome laseroscopic surgery on January 4th. So it's been a little bit over 4 weeks. They lasered 15 blood vessels, which I feel, in my opinion, is a lot. Like, I was just mind blown by the number. So I just thought I would share that random fact. But let's get into the questions. Okay, the number one question we were asked was, do you know the gender? And at the time, we had not announced the gender of our babies. Now we have announced, so if you haven't seen the gender of our babies, they are girls. That was like the number one topic of discussion. I took a poll on my Instagram of how many people thought we were having boys versus girls, and it was almost an even split. And I finally felt confident enough to post that we were having twin girls. And by confident, I mean like in the safe zone, which is unrealistic because I don't know if you're ever in a safe zone. In my illogical brain, if I posted that they were girls, something bad would happen to them. So I held off posting that they were girls through all of the TTTS stuff. We've known they were girls since like 11 weeks, I think, or 12 weeks. We did the NIPT test, the specific one that can test. It tells you both of their genders and if they're identical, but we already knew they were identical before that just by looking, you know, they share a placenta, so that can tell you if they're identical. But also if you have di twins that each have their own placenta, there's still like a 30% chance that they could be identical. So this NIPT test tells you, you know, if they're identical and their genders, of course, and their risks for different genetic things that could go wrong. So we've known for a long time, the boys have known for a long time, and I finally have felt confident enough to like put it out into the world. So it's pretty exciting. We have 5 boys and now we're gonna have 2 girls. Yay! At least I'm like still really outnumbered, but at least I got some like teammates on my team now. Do you plan to have more kids after this? No, this was supposed to be the last baby and it turned into the last 2 babies. Will you need the procedure again, or was it a one-time deal? For most people, it's a one-time deal. For me, they considered my surgery complete, so it is in fact should be, I don't want to like jinx myself or something, a one-time deal. There are like rare cases where people will have to have the surgery like twice, but that usually doesn't happen unless it's like incomplete or your babies are suffering from like post-laser taps or things like that. When are your twins going to be born? So we don't know when they're going to be born. It's just like any other pregnancy. You can't really predict the future. I'm almost 27 weeks and we're just kind of playing it by ear. They want me to keep them in for as long as possible. A lot of people didn't ask questions. They were just like sending love and prayers and positive vibes and saying things like I've been called like strong and a bunch of different things, and I appreciate that too. How are you feeling about the whole situation mentally, emotionally? It was mentally and emotionally exhausting. I mean, it still kind of is, but it's definitely less exhausting now. The further we get out from the procedure, the better I feel about the babies. It was draining. This whole pregnancy has been draining. I feel like I normally take like weekly photos and I do like fun things, and this pregnancy kind of like squeaked by and I didn't do any of those things because I was really just worried all of the time. Does the surgery make it so the baby with less room fluid will thrive now? So the baby that had less fluid was still thriving. They weren't thriving. They weren't not thriving because both my babies were pretty much the same exact size. They just had less room to move around. The surgery essentially made it so that she would have more room to move around and less stress on her heart. It took the stress away from both of their hearts. So they are both thriving, but they weren't not thriving before, especially the one with less fluid. She was still thriving, but in her own way. So are these signs that you're most likely going to have a C-section? No. After talking with the doctors at Johns Hopkins, as long as, you know, the rest of the pregnancy and the position of the babies goes as planned, then I can still attempt a vaginal delivery at the end of the pregnancy. This does not mean that I automatically have to have a C-section. Were you awake while they did it? Of course, I talked about this in my other twin-to-twin video, but yes, I was awake. They do not give you an epidural. They just use like a local lidocaine and do like a tiny incision. They don't even give you stitches. It's just they put some steri strips on it and call it a day. They want you to try to be as perfectly still as you can be, so that's why they don't put you to sleep. What will you be watching or reading while on bed rest? So I was on bed rest for 2 weeks, but I don't think I watched or read anything. I had different family members and friends rotate their time here at our house helping out with my older kids. I pretty much put them all to work with my nesting. I was a psycho crazy person. I think we ended up getting like over 10 bags of clothes out of the boys' closets. Like I just sat, didn't do too much, but we definitely went through this house and got a lot accomplished. Was the procedure painful at all? So it wasn't painful because they gave me the lidocaine. I didn't feel them do the incision and I couldn't feel them doing anything else. They did give me something to take the edge off, but I really couldn't feel anything at all during the procedure. Did the doctors give you a goal as to how far they want you to make it in pregnancy? I'm pretty sure with Modi twins, the cutoff is like 36 weeks and 6 days or something. Once you hit the 37-week threshold, I don't really know the science behind this, but like your placenta starts to fail because you have 2 babies on 1 placenta. So I guess it's just kind of another one of those things that I'm gonna play by ear with my doctor and my high-risk doctor and decide like if I don't go into labor, if I will need an induction, or if the babies aren't in the proper position, then I would need a C-section. Somebody asked, how does this happen and why? If you are wondering the answer to this question, I talked about it in our story. Don't forget to check it out. It's not something you can prevent. It's not something you did. It's just the way the placenta grows and how the babies grow, the blood vessels in the placenta. And it's like uneven sharing of the blood supply. So there's really no way to prevent it. And surgery is one of the ways to fix it. Sometimes as your placenta grows, you can just grow out of it, but that doesn't happen for everybody. Will you have a home birth or a water birth? My last 2 babies were born at home in the water. Probably my 2 best births ever, after my 3rd one was almost born at the movie theater. But no, these babies will not be born at home, unfortunately. That was the plan when it was just supposed to be 1 baby, but since it's 2 babies, I mean, you can have twins at home, but my twins are more of a risk because they share a placenta, so we will not be birthing these babies at home. There's a risk of the placenta detaching before the 2nd baby comes out since they're both on the same placenta, which then they would need to emergency C-section you to get that 2nd baby out, because before your baby is born, the placenta is their oxygen supply. So if the placenta detaches before the 2nd baby comes out, you have a problem. That's not good. So that is why I am not going to risk it by having the babies at home, and I will be having the babies in the hospital, even though I'm not like super excited to have them in the hospital, but I mean, what can you do? I want them to be safe. You know, if an emergency were to arise, I want to be in the hospital ready to go. Somebody asked if it's genetic. It's not genetic. It's just something with the way the placenta grows and the blood vessels inside the placenta. Are they gonna have Z names? All of our sons' names start with the letter Z, and the girls, that's so weird. We're having girls, not just 1 girl, we're having 2. They will both have Z names as well. I mean, I can't back out now. We will have the Z kids. We will call them the kids, because right now we call them the boys. We'll have the boys and the girls, or we'll have the kids. Do twins run in your family? Short answer, no. Twins do not run in my family, but also identical twins are spontaneous. They haven't found any scientific reason of why it happens, so right now they consider it to be spontaneous. So yeah, twins do not run in my family, and it also only matters on the maternal side, not the paternal side. So even if your husband's a twin, or like your husband has twins that run in his family, it doesn't make any difference on the mom, because the mother is the one that would have to hyperproduce eggs to get twins. Yeah, and I think that's pretty much it. That was all the questions I've gotten. A lot of the questions were duplicates, or people just saying they were praying for me, sending positive vibes, saying you got this. I really appreciate everybody's support through that time. I'm happy to be, you know, further away from surgery and recovering well. But yeah, we're 27 weeks, so we're almost to the 3rd trimester, and I'll be sure to do a 3rd trimester update where I talk about my gestational diabetes, because, you know, it's just one thing after another. I get through one issue and another one arises. This twin pregnancy has definitely been a roller coaster, but I'm trying to enjoy the journey as much as I can. I'll be super happy when they're here safe and sound. Well, I'm done rambling. So that was my little Q&A on TTTS. If you have any other questions about our twin journey so far and like what has been going on, feel free to drop them in the comments, and I can do another Q&A video later on down the line. If we could just fast forward to like May, after they're here, when I'm trying to get into, you know, a routine, I would like that. This pregnancy has definitely been rough. So thanks for watching. Give this video a like if you enjoyed it, because, you know, it helps my channel. And I'll see you in the next one.